Hello and welcome to the COMLEX Instant Review. I want to talk about varicella. Varicella is given 12 months of age or older for healthy people who have not had varicella. Two dosages for all, and the second dose is usually given between 4 to 6 years of age. Varicella after the vaccine is usually milder with lower rates of fever and rapid recovery, and varicella transmission is rare. Zoster is reported but at a much lower rate than the occurrence after the disease. Also, live attenuated vaccine issues, for example, previous IG, immunocompromised, or HIV state, have some special considerations. You should delay immunization of recent administration of IG. You should give to HIV patient as long as there's no current HIV related infection and the CD4 count is greater than 15%. So, some special rules about varicella are that it's given two dosages, 12 months of age or older for healthy people, the second dose at 4 to 6 years, and generally for patients who have recent administration of IgG, the vaccine should be delayed. And you should give it to HIV patients as long as there's no current HIV related illness and the CD4 count is greater than 15%. Now what about household contacts? Well, you should give the vaccine. It doesn't matter. You should still give the vaccine to the patient. You should give the vaccine to susceptible household, immunocompromised, or pregnant contacts because transmission is rare. If a vesicular rash occurs in the immunized patient, then no direct contact for the duration of the rash is recommended, and if inadvertently there's some contact has occurred, no IgG is indicated because the risk of transmission simply is really low. So that's the key point here. For varicella, you should still give it to household contacts because the risk of transmission is quite low. Now, what about post-exposure prophylaxis? Well, the key part here is going to be that an administration of the vaccine to susceptible immunocompromised children within 72 hours after the exposure may actually prevent or significantly modify the disease and should be considered. So, if a patient comes to you with complaints that they have been exposed to varicella, what you need to look at is the time interval. And if you want to look at the time interval, it's usually 72 hours. That was just some of the high yield points that you're likely to see about the varicella vaccine on the COMLEX board exam. Also keep in mind that with the varicella vaccine, patients who are at high risk of developing severe varicella should be given VZIG ASAP within 96 hours of the exposure. Now, what type of patients are actually considered to be high risk? Well, pregnant women, immunocompromised without a history of varicella or immunization, newborn whose mother had an onset of chickenpox within 5 days before to 48 hours after delivery, and also hospitalized preterm infants. What about varicella in pregnancy? Well, you would use VZIG, and the use of VZIG should be strongly considered for susceptible exposed pregnant women, but it does not prevent any fetal infection or neonatal varicella. So the indication is to prevent complications in the mother. That's the key thing. If serious complication in the mother, such as pneumonia, develops, then IV acyclovir should be considered. And if the pregnant woman is susceptible, she should be vaccinated as soon as she delivers. And the second dose can be given in the 6 to 8 weeks at the postpartum visit. Also, with the vaccine, breastfeeding is okay. Now let us review some of the high yield points we just talked about for varicella. For varicella vaccine, remember that it's two dosages, one at 12 months and the second dose between 4 to 6 years of age. The patients who have had previous IG or in immunocompromised state, um, you should delay the vaccination if there's been a recent administration of an IG. And you can give the vaccine to HIV patients as long as there's no current HIV infection. And for household contacts, you should still give the vaccine to susceptible, immunocompromised, or pregnant contacts because the transmission is extremely rare. And so if a vesicular rash occurs in the immunized patient, then no direct contact for the duration of the rash is recommended. And if inadvertently contact does occur, then no IV is indicated because the risk of transmission is low. So again, one key point, in the households, you do not need to really give the IVIG because the risk of transmission is low. You still give the vaccine to susceptible household and immunocompromised or pregnant contacts because transmission is rare. Now, post-exposure prophylaxis includes giving the patient, the susceptible ones especially, which are the susceptible immunocompetent patients, vaccine within 72 hours after the exposure, because that may prevent or significantly modify the disease, and that should be considered. Also understand that susceptible people at high risk of developing severe varicella should be given VZIG as soon as possible, but within 96 hours of the exposure. Immunocompromised patients without history of varicella or immunization, a pregnant woman, newborn whose mother has had onset of chickenpox within 5 days before to 48 hours after delivery, and hospitalized preterm infants are considered to be high risk. That was a board review for the COMLEX and USMLE board exam on pediatric immunizations. Please visit COMLEXFlashcards.com for additional lectures and daily blog posts to help you get through medical school. That's www.comlexflashcards.com, and good luck in your preparation.